A cheap antidepressant may reduce the risk of severe symptoms of COVID-19 by a third. Here to answer your questions about that and a lot more, Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Doctor, thanks for being with us, as always.
Great to see you, Dr. T. So the results of this clinical trial are intriguing. I'll let you grade how intriguing. Let me share, I say it right. Fluvoxamine, am I in the right ballpark? It's often used to treat OCD and depression. So why do researchers think it could help patients with COVID?
That's right. The good news is about a year ago, there were some observational studies, small clinical trials that showed benefit, decreases in hospitalization. We think not only does it provide antidepressant and activity against people who have OCD, but it also has some anti-inflammatory products. And in that way, we know that COVID is such an immune boosting signal where you can get a storm in your body. So we think by giving fluvoxamine, you can decrease that. In this larger randomized controlled trial from Brazil, patients were randomized, about 1,500 were randomized to fluvoxamine 100 milligrams twice a day for 10 days or placebo. And what they showed is that the patients who received the fluvoxamine were 1/3 less likely to get hospitalized than the placebo. Right. Even better news, when they looked at patients that took more than 80% of the drug, there was only 1 death in the fluvoxamine group. There were 12 deaths in the placebo group. That's really significant. Yeah. So I do think this is very promising, and it's going to be something that I'm considering prescribing to my outpatients who are high risk for severe COVID disease.
Quickly, doctor, are there any treatments that you're using right now to keep COVID patients out of the hospital?
Those monoclonal antibodies, Maria.
Right.
And at our system at South Shore Health, we've been using that more and more, and we've been seeing that less patients are coming into the hospital who receive that treatment. So if you're high risk, if you're obese, diabetic, immunocompromised, or older, you want to think about getting those monoclonals if you're symptomatic with COVID.
Wait, Dr. T, what are you telling patients who ask if they can take ivermectin to treat COVID?
Absolutely not. That's an easy one. Has not been shown to work.
Let's get to some of the emails, or one of the emails from a viewer. This is Matt. He said, I got 1 shot of the J&J vaccine in April, so I'm looking for a booster. Does it matter if I get a full dose of Pfizer or a half dose of Moderna? Can I ask for a full dose of Moderna?
Right. So the EUA that we just heard from the FDA and the CDC is going to be that half-dose booster of Moderna. So you could ask for the Pfizer full dose or the Moderna half dose. And either one seems great. I think the important thing here is get a booster. And we know that the messenger RNA vaccines like Pfizer and Moderna boost better than that second dose of J&J.
Dr. T, great to see you. Have a wonderful weekend.
Be well, doctor.
Thank you.